What we have been using these meetings for to a large extent is to connect a variety of resources that may strengthen responses to employment needs of people living with HIV or people with reasons for HIV prevention. I'm really grateful to each of the agencies and each of you individually for contributing to our discussions and strategizing. It is indeed the case that historically, at the national level, few people living with HIV and even fewer people with reasons for HIV prevention have gotten access to services and supports and resources to address employment and economic needs in the context of HIV care and prevention. It's been a huge honor and privilege to work with folks doing amazing work in Chicago. And I appreciate that you each continue to contribute. I will tell you quite honestly and transparently that I have now had my eye on the impending Medicaid work requirements for what feels like quite a while. And um, we were really hopeful that when CMS released their interim final rule, which happened as scheduled on June 1st, that there was the possibility that people living with HIV could be exempted, or that states would have the power to choose exemption for people living with HIV and other uh, folks with chronic health conditions and disabilities. Uh, and quite honestly, it was really uh, a tremendous disappointment when the rule came out that precludes a blanket exemption of that kind. And I'm quite anxious about the slow awakening of our communities across the country to the risk that the implementation of work requirements can represent for so many people living with HIV. My understanding is that of the 1.18 million of us projected to be living with HIV in the US, um, something like 40% of us are reliant on Medicaid for access to health coverage, for access to meds, and then something like 42% of that number are in the Medicaid expansion groups, who are the folks for whom the Medicaid work requirements will be implemented by January 1st of 2027. So my personal rough calculations are that could be something like 200,000 people or more nationally who have been relying on Medicaid for their access to healthcare and treatment, for whom it will now be necessary to manage and navigate the bureaucracy that is being um, built as we speak in a variety of different ways from state to state. I'm hoping and believing that Illinois will build uh, one of the more humane bureaucracies related to their requirement to implement the Medicaid work requirements, and that many of you in this meeting may have an opportunity to communicate uh, to influence that is the outcome. Um, I'm super grateful to Nadine Israel for joining us today to share a presentation and participate in Q&A and discussion related to what the Medicaid work requirements mean. There are some strong areas for concern, but there's also some potential strategic opportunities to be aware of that may be important in our work and for the folks that we serve. And as I am understanding what we're looking at. And I think with that, I will just turn it over with tremendous gratitude to you, Nadine.
Thank you so much, Mark. And thank you all for giving me the opportunity to be with you all, share space, and talk about this looming thing that's coming all of our way. Um, so just a little bit about me, because I don't think I've definitely shared space with some of you, but not everybody. Like in terms of my professional experience, my in grad school, I did social work as kind of my background, although I'm not a licensed social worker. I didn't sit for the test, and I haven't done clinical work ever. But that's kind of the approach that I bring to policy work. So I've been doing like healthcare and mostly housing, and some other bits, but mostly healthcare and housing policy advocacy work in Illinois, a little bit at the federal level for the last like 17 years. And for healthcare, for me, like when I came in to doing this work, they had just started, they meaning the advocates, the healthcare Medicaid advocates, had just started implementing Obamacare, the Affordable Care Act. So I came in at a really lovely time, and that it was all working on proactive policy work. How are we going to implement this and increase access in the best way for hundreds of thousands of people in Illinois, including people with HIV, to Medicaid and to Affordable Care Act private health insurance plans. Um, so for today, not knowing everybody's kind of like experience and knowledge and background, I know some of you, so I know you have a little bit of, I know you have at least some sense of this, but not knowing everybody's, I want to, I'm not going to do like a PowerPoint. I'm going to share a couple of things in the chat in terms of resources to digest, but I also want to make sure that we're like working off the same information and the same kind of starting point as much as possible. So first, I'm going to drop a one pager that we created. My colleague Meg, actually, my IFC colleague Meg McElroy, who heads our Getting to Zero Illinois initiative, created in the chat. And this one pager, we just created it like a couple months ago. And it's basically to help anybody understand the connection between Medicaid, people living with HIV, and what's coming in HR1 because of HR1, specific to Illinois. So one of the things that Mark mentioned, we actually have like estimates of like impact for people living with HIV when it comes to Medicaid work requirement. And so some of those stats are in this one pager. So I would download it, save it, but also take a look at it because it's I think a good starting point also because it gives one of the sides of the one pager is a background on Medicaid if you're like not as familiar with the Medicaid program at all. If you're not familiar as much with Medicaid, it's a health insurance program. It's just a public health insurance program. What makes it unique is that it's a federal-state partnership, meaning there are some things that the federal government says, states, you have to do this in order for us to pay some of your Medicaid bills. And there are some things that the federal government says for Medicaid to states, it's an option for you. So state, you can implement it if you want to, or you can not implement it if you want to. Yeah, so exactly. So for looking at Illinois more specifically, we've got roughly the numbers go up and down, and they've been going down more recently, unfortunately. Roughly 3.4 million people in Illinois will have Medicaid as their health insurance program, which is roughly 25% of the population, as Mark noted in the chat. If we drill down more to people living with HIV, yep, for going down to ACA adults, so people who gained Medicaid health insurance because of Obamacare, because of the Affordable Care Act, that is roughly 770,000 people. Looking at people living with HIV in Illinois more specifically. So there's roughly something like 16, 17, 18, 19,000. I can't remember the exact number. But it's 42% of people living with HIV in Illinois who are on Medicaid. I remember the percentage. So of that 42%, a little over half, 51% of people living with HIV in Illinois are on Medicaid because of the Affordable Care Act, because of Medicaid expansion. So what that translates to for us in terms of, again, the kind of the worst parts of HR1 in terms of impact, including the Medicaid work requirement, the worst parts impact the ACA adults, Affordable Care Act adults, who are on Medicaid. And for people living with HIV in Illinois, that's roughly just under 10,000 people. It's like 9,500 people. So when we talk about Medicaid work requirement and people living with HIV in Illinois, that's our rough net number. We're talking about roughly just under 10,000 people living with HIV in Illinois on Medicaid as of, end of 24. So that, again, those numbers are going to fluctuate, but it helps to have how many people are we talking about? Which is not a small number of people. Again, of the 42% of people living with HIV in Illinois who are on Medicaid, more than half of them, 51%, have their Medicaid because they're an ACA adult. They're an Affordable Care Act Medicaid expansion adult. And you'll remember that the reason why all these folks didn't have Medicaid before the ACA is because Medicaid didn't acknowledge you to need health insurance unless you had a disability or you had a minor child or you were a senior, essentially, or you were a minor child. And so it left out a big chunk of people before the Affordable Care Act. And the people were essentially either folks who didn't have children or folks who had grown children, despite how poor they were. So let me pause and see, since we're a small group, if there's any questions, like clarifying questions to what I've shared so far. Because the more we dive in, the more we layer on this information. Okay. Not hearing any, I'm gonna keep going. And Mark, please stop me if there are things that you want to like either hit harder or anybody else really. Like this, I'm hoping this is helpful to you also. Whatever you need, that's what we should be and how we should be talking.
And Nadine, I seem to have lost the internet for a second, and I'm glad that it didn't seem to affect the meeting and that I had made you and Charles co-host, so maybe that prevented it. But if I were to ask for some particular focus or emphasis that you may have talked about while I dropped out, it would be where there may still be levers to influence how the Medicaid work requirements, the community engagements requirements are implemented in Chicago, and how advocates can be involved in that, and also what service providers who work with people living with HIV who are in the ACA Medicaid expansion group can know for planning how to take care of themselves and as the implementation happens.
Absolutely, absolutely. Yep. And that's the meat of what we're talking about. Absolutely. But I wanted to make sure that we, again, because all of it nests within it's each other. So it's important to have at least have a sense of like, who are we talking about? The other reason why it's important is because the Medicaid work requirement is not going to be impacting everybody living with HIV. So that's an important thing because people will think that they have to comply when they don't, right? So again, the first thing that you want to remember and tell anybody that is in your circle is that the Medicaid work requirement, and there's another piece actually that also it only impacts Affordable Care Act Medicaid participants, right? People who got Medicaid because of Medicaid expansion, is if you recall, there's a redetermination or renewal process that happens once a year right now. So basically what the state does, and they have to because the federal government says so, is they look at everybody's eligibility that's on Medicaid once every 12 months to make sure they still qualify for the program. That's called Medicaid redetermination or renewal. The law, HR1, changed this just for people, just for ACA adults, Affordable Care Act adults. So just ACA adults, the state is going to have to do their redetermination twice a year instead of once a year. So I have once every 6 months instead of once every 12 months. The reason why that's important is because we know that anytime somebody has to go through a redetermination or fill out paperwork to prove once again that they qualify for Medicaid, they could get dropped. Not because they don't qualify, but because of some administrative burden. some administrative, they didn't get their mail, they didn't understand it, et cetera, et cetera. So what will happen starting next year is that we are going to see these two specific policies within HR1 negatively impact specifically ACA adults. Medicaid expansion adults is another way to call them, who are on Medicaid, because they only apply to those types of people. So again, if you are not an ACA adult, you're on Medicaid, but you're not an ACA adult, the Medicaid work requirement does not apply to you. So if you somehow, somebody's telling you, whether it's a caseworker, whoever it may be, that is not correct. The law says that is the federal law, HR1, that is not correct. So that needs to be rectified, and you need to connect with somebody to make sure you get it rectified. And if you're not sure who to connect to, start with any of you, I'm sure, but you can always reach out to me. If you have somebody who ends up in this situation next year at any point, and you're like, I don't know where to start, feel free to reach out to me and we will figure it out.
Nadine, that's awesome. Is there a way to easily detect if someone's Medicaid enrollment is an ACA Medicaid expansion enrollment or not?
That is an excellent question. That's what we're trying to work with the state Medicaid agency on right now, because there isn't. Even people, so right now, I imagine most of you don't have access to Medi, which is the Medicaid system. I don't either. Usually it's Medicaid providers that would have access to it, because they need to look up, hey, how is, this person had Medicaid? Did they still have Medicaid, etc. Even Medi, their system doesn't show, that we're learning, doesn't show for everybody who's a Medicaid provider. If the person in front of them is an ACA adult, if they're a child, and that's why they have Medicaid, if they're a senior or a person with disability. So it shows it for some types of providers, but not for everybody. An example we've learned is that mental health and substance use providers in particular, who have access to Medi, aren't able to see the type of Medicaid that the person has. So what we're trying to work with the state on right now is, okay, a lot of us aren't going to have access to Medicaid. We're not Medicaid providers, but we are going to see people who are going to not know if they're an ACA. Most people aren't going to know why they qualify. They just know that they qualify for Medicaid. So we are working with the state Medicaid agency right now to essentially have something that is anybody can use, like whether it's a phone number, there's Manage My Case, which is a patient portal, but different ways for somebody either to help a person or for the actual individual who's on Medicaid to figure out themselves, hey, am I an AC adult or am I something else? How do I have Medicaid? So that's very much a topic I've had like 5 meetings already this week just about this particular piece. And that's not an easy, unfortunately, because the systems, it's not an easy fix. But it is you've kind of pinned a really important point, because that's the first question that anybody should be asking. Is this person an ACA adult and that's how they have Medicaid, or are they somebody else? If they're somebody else, the work requirement does not apply to them, and they should not be getting twice a year redeterminations. Okay, so now, of course I'll communicate, when there's updates and things like that, we'll communicate as to like what the state has figured out, how do we figure this out, and how do we help others figure it out. Now let's drill down more into the Medicaid expansion population, the ACA adults who the Medicaid work requirement does apply to. Even within that population, even within the ACA adults, the law, HR1, says that some people should be excluded or exempt from the Medicaid work requirement, even within the ACA adult population. That's the actual HR1 law says that. So even when we're thinking about that 9,500 people living with HIV who the Medicaid work requirement will apply to, some of them are going to be exempt or excluded from it because they meet one of 5 categories or thresholds that the law HR1 has in it. So then that narrows down our pool, right? What Mark was referring to that came out recently is one of those 5 categories in the law was said that if somebody has a serious or complex medical health condition, if they are medically frail, the Medicaid work requirement wouldn't have to apply to them. That's what HR 1 said. However, as Mark said, so we, up until that June 1st interim final rule that came out just very recently, we've been advocating, and some of you I know signed on to this letter with the state, and the state was going to do this, to just blanket exempt people living with HIV from the Medicaid work requirement. Why? Because it is both actually a serious and complex medical condition. And while many people living with HIV do work and are able to work, the having to meet a paperwork reporting threshold is going to mean many will get dropped, even though they still qualify, and that's going to interrupt their care and lead to worse health outcomes and actually less engagement in work, which you all know. And the state had said, yeah, this makes a ton of sense. The state of Illinois was going to be very expansive, still meeting the letter of the law, but expansive. When the June 1st interim final rule, so it's an administrative rule, came out from the federal government, from CMS, Centers for Medicare and Medicaid Services, it literally said you can't exempt somebody just because they have a serious or complex medical health condition, which is in direct contradiction with the federal law with HR 1. But that's what it says. And that's the guidance that states have. And that is going into effect July 31st of this year, that interim final rule. So what it said is you can't blanket exempt, right? It said the person has to be living with a complex health or chronic health condition. And that complex or chronic health condition has to be severe enough. They have to show that that condition is severe enough that it impedes their ability to meet the work requirement. So that's a whole nother ballgame. Now we're talking like individual cases and having providers. Providers aren't even equipped for this, most of them. They have no way of being able to talk to me. And first of all, I have to have insurance to go see a provider. So if I don't have insurance, my chance of seeing a provider are much smaller. But let's say I somehow ended up in front of a provider. How are they going to assess whether my HIV is, I'm not a person living with HIV, but is severe enough throughout the year and it's to impede my ability to meet the Medicaid work requirement? That is a standard that actually could be argued is higher than a disability standard, which is insane. But again, that's what the interim final rule says. And that's the guidance that states have right now. So the option of that blanket exemption of people living with HIV from the Medicaid work requirement at this particular point is off the table. However, just yesterday, a bunch of states, including Illinois, sued on this interim final rule. Yes. So what we don't know is what's going to happen with that lawsuit and what that is going to mean in terms of implementation of the Medicaid work requirement in these everywhere, but particularly in the states that sued. So it's still to be determined, but the door is not completely shut yet on like a blanket exemption, because there could be something that comes out of the lawsuit that still allows the state to blanket exempt, but obviously it's going to be delayed if that happens. So the first advocacy opportunity that I want to share with y'all right now is there's a comment period that's open right now for the interim final rule, where organizations can submit comments and say, here's why this doesn't work. Specifically, we want to encourage comments on the Medicaid work requirement piece. So I'm going to drop in the chat before we wrap up template comments, so that if you're somebody who's like, I have no idea what you're talking about, I've never commented on behalf of my organization, I don't even know what this is, you can literally just read through these template comments. They give guidance. We created them. My colleague Megan at Legal Counsel for Health Justice actually created them for the Protect Our Care Illinois Coalition, which we are a part of. We did a webinar about them yesterday to walk folks through that. I know Mark had shared with you all. So I'll share the webinar recording. Maybe I can share it with you, Mark, and then you can share it with the folks in case they missed it. But my first ask in terms of advocacy would be submit a comment on behalf of your organization. Or if you're not the right person, convince whoever the right person in your organization is to submit comments and use these template comments from Protect Our Care to craft your comments. They don't have to be long, but they do have to be specific. So the webinar that we did yesterday talks about basically the purpose of commenting, how to comment, what things to keep in mind. Especially if you've never commented before, it could be helpful to listen to. Comments are due July 31st on this one. Yes, wonderful. Thank you, Mark. They're due July 31st. And then also Protect Our Care, we're doing office hours on these comments specifically on July 13th, so in 2 weeks. So July 13th at 2 p.m. I'll share the link, the Zoom link. There's no registration required. So let's say you're like, start your comments and you get stuck, or you're not sure, you still have questions before you start, you can come on July 13th, anytime from 2 to 3, hop on those office hours and ask wherever you're stuck, and get some help to get going. We really want to encourage as many organizations. It's going to be really, really important for the record, especially even for this lawsuit, to have as many organizations comment on this interim final rule and talk about why it's bad, specifically the work requirement piece. And for us as organizations impacted, thinking about people living with HIV, those impacted by it, it's going to be really important to build that public record from that perspective. So that's ask number one. Then drilling down in terms of what Mark had mentioned in terms of, okay, so if you are an organization, which it sounds like many of you are, who either are already in this space of employment, serve people living with HIV or impacted by HIV, like what can you do to prepare, either to advocate for your clients and to prepare for what's coming? So I will drop this right now, actually. So this hasn't been figured out basically by the state yet, is the short answer. The state, they figured it out. DHS, Illinois Department of Human Services, has figured it out for SNAP because they had to figure it out sooner for SNAP. In terms of how do people meet the work requirement. Let's say for the people that this does apply to, they can't be exempt, they are an AC adult, they have to meet it according to HR 1. How do they meet it? So they figured it out for SNAP because SNAP rolled out earlier, the food stamp program, Medicaid work requirement. For Medicaid, because the implementation doesn't start until January 1, 2027, the state hasn't fully figured this out yet. But I want to drop the DHS, our Department of Human Services, and I know we have somebody, a representative from DERS on here. I believe we do. So this is, I would say, bookmark this website on your whatever the thing. This is DHS's web page right now that talks about, again, specifically for SNAP, but it talks about connecting to opportunities to meet work requirements. So actually, let me see if I can screen share really quickly. Okay, there. So this is the link that I just dropped. So it's legit. We know it's legit because it's Illinois Department of Human Services. And it talks about, again, this is for SNAP, but I imagine this is what's going to get built out or replicated or something built on for Medicaid in terms of, again, for the people, some people will have to meet it who are on Medicaid. So how can they meet it? So the reason why I'm showing you this page is because this tells you right now how DHS is approaching this for SNAP. So there's this Job Ready Illinois online job readiness training. Because again, the work requirement is not just about engagement in work, right? It's engagement in volunteer activities, it's engagement in training or engagement in work. It's 80 hours a month that can be spread across any of these types of activities. Serve Illinois is for volunteers, and I know we have somebody who on this call who it sounded like maybe I don't think you're Serve Illinois, but you're Joyce. You mentioned Volunteers for America, which is what got stuck in my head. And then they also include work opportunities. So let's say I'm somebody on SNAP right now who needs to meet the SNAP work requirement, and I'm like, okay, is anybody going to help me? Like besides just like cold putting in applications. This is the state's way, DHS's way of having some information in one spot. And then this is more information about basically like if you to prove that you're meeting the work requirement. This is information about volunteer opportunities that they have, approved qualifying work programs, approved by the state. So that's really important because it can't just be anybody. Connecting to education, because you can meet it by also being in an educational program, and then additional resources. So I'm going to stop screen sharing. So what in terms of engagement for you all, one of the things oh, go ahead, Lynn. Sorry, Lynne.
Hello. Sorry, you just mentioned something I was like pondering and thinking and actually just talking to my team. We are employment service provider. But this was something in terms of with SNAP, like clients have started to ask us for letters, but I mean, our program, the qualification, what qualifies as a program is like a whole different scenario. And it's like basically our program, by the time it begins, it's over. We did write letters for clients, but I was like, I don't think this is going to do anything because I don't even know what a qualified, I think it has to be then a WIOA program or something. But I'm curious if you have any other information about what does it mean to qualify? And and I know you can't answer, but like, I was like, I don't know if it's worth it to attempt to do because it might just take me down this journey. I'm sure you know what I mean by that, like that it's like a blip in a bigger thing.
Yeah. It's on my to-do list in terms of there's a person at DHS that I'm told is like the person that is implementing for the people that have to meet the work requirement, like what counts. And you know what I mean? Like which of these count? And so that's why part of the reason why DHS put together this webpage is so that everybody has a sense of at least a starting point of what counts. But I'm hoping it's on my to-do list to reach out to her, actually to like bring her, hopefully to have her present in that Protect Our Care Coalition that I mentioned in one of our meetings, so that we can learn a little bit more exactly to your question about like, okay, like literally I do employment services. So like, does my program count? And if it doesn't count right now, what do I need to do to make it count? Because then you can decide, okay, is it worth the time and the effort and the investment to take the steps to make it count? I would say I would love, as obviously as much, especially if folks focus on people living with HIV or vulnerable to HIV, to whatever that is, to be engaged, because that's going to be for people living with HIV, impacted by HIV, the easiest way because they're already connected, right? They're already connected with you and with all of you. But I understand organizations have to think about like, this is literally like 100 steps to get there. Is somebody going to pay us for this to get to do the work to get there? So I do understand that there are like lots of questions that organizations would have once they understand even what it takes for your program to count, for your employment program to count or not. One thing I can do, and again, I don't know this person, so I don't have a relationship with them directly, but I'll find her name and email address, and I will share. Again, maybe I'll just share with Mark if you don't mind, and then you can share it with the group. That way you can maybe just do your own even direct outreach. You don't have to wait on me or anybody else, and just be like, hey, I do this work. I'm trying to figure this out for SNAP right now, but eventually for Medicaid as well. Whatever you want to ask. If you want to ask for a meeting, if you want to ask, this also might be a good person, Mark, to invite to this space to talk to like a group of people. Because you all are like in the intersection of work, right? Employment, some kind of engagement, training, HIV, and you have people who are on Medicaid, people living with HIV, impacted by HIV, or Medicaid, SNAP, or both.
Thank you. That's really helpful because even just understanding, because even just my staff, like they're like, well, where's the template for this letter? I'm like, there is no template. Like, like this is. There's no template. I don't know if it's going to work. It doesn't Like, well, can you sign it? And it's like, okay, well, anyone can sign it because at this point we don't even know anything. But so I mean, that's sad, but it's also why I'm here and helpful, because I think that even just, clients have such a hard time in general, like they're bumped from program to program, and already just engaging in a work program can be hard. Now it's a specific work program, right? Like, and
then proving it.
right.
It's not, and then proving it.
Right. And in my experience, the work programs that are very rigid are not like that's why it's not going to really land. It's like then it's like regimented. The documentation requirements are intense. Like it's basically like applying for Medicaid to get into that program because it's all connected. I know I'm preaching the choir in that, but at least it's I'm among my people, and we know that it's kind of like I don't know, a bunch of bananas, what's going on. And we I just was like, oh, I don't know. Like, so thank you for that. And more hope. And I'm happy to find out more info about any of these.
Yeah. And it's also important. I appreciate you sharing, because it's also, I have to remind myself as well. This work reporting requirement in HR1 was never about work. There's a ton of data that shows it actually doesn't work. It doesn't help anybody stay or get engaged in work, and it doesn't. All it does is kick people off of Medicaid who qualify for Medicaid because they can't keep up with proving that they're still eligible, that they are working, that they are engaging in voluntary, et cetera, et cetera. So the intention, the setup, the setup is to set up to kick people off. So we have to remember that, because our job is to mitigate the harm as much as possible. That's what we've literally been doing since this law passed July of last year. And so we have to keep doing that, of course. But we also have to remember that their intention was not about work, no matter what they say. We know this. They were trying to kick people off of Medicaid so they can save money, so they can extend the tax credits for the ultra wealthy. And that's what they did, both for Medicaid and SNAP. They took billions of dollars out of these two programs and literally extended tax credits for the ultra wealthy that were going to expire. Go ahead, Dr. Pierce.
Hey, so you just made me think about something really, I don't know, disheartening about the, kicking people off of Medicaid. And then earlier you talked about complying versus not complying, right? So people just don't know when they have to. I want to give you a scenario that's real. I know pockets of community who get kicked off from Medicaid while they are incarcerated, right? So they got some jail stuff going on, then they don't do the administrative work. My question is, when they get released from jail, but maybe on like the ankle band, the monitor, right? Because they are out, are those individuals able to reapply? Or do they have to wait until this case is over, especially when they're medically frail?
They definitely do not have to wait. And in fact, that's an excellent question. So there is something actually that I have to look back in at the law for the specific language, but there is language that exempts essentially people for a certain period of time once, like pre-release, that like 90-day pre-release, and then like once they're out. So I'll find the language so that I'm not misspeaking. But to your specific point, because I'm talking about HR1 for that particular language. To your specific question, no, they don't have to wait to apply for Medicaid. So actually, they can, depending on their, their case and stuff like that. There's in Illinois, 90 days pre-release, they can do their Medicaid application essentially, so that day one, when they're out, it's a little bit harder, I know, with jail, but I know Cook County Jail at least has more staff that are versed in this, so that when they're out, they essentially have their Medicaid card in their hand.
Oh, wow.
So that they can, again, because it's like initially, you're like, you come out like, okay, if you're on any kind of prescriptions, if you need an appointment, if you need to take care of something, that like, wasn't taken
Mhm.
care of because their system
Mhm.
basically sucks.
Mhm.
So yeah, so that is definitely something that they do not need to wait. As when they're out of the system of the incarceration, so jail, prison, whatever it may be,
Mhm.
they qualify for Medicaid day one.
Mhm.
And actually even 90 days before
Right.
they can start the
Mhm.
paperwork. And that part of it is because Illinois passed a couple of laws over the last like 5 to 10 years to make that happen. So yeah, so that's the
Wow.
answer to that.
Thank you. That was helpful. There's some miscommunication that when they know they're going to get released on the ankle monitor, they won't be
Yes.
able to apply. And I'm like, but okay, but you still got to
So
go to.
yeah, so if there are specific, this is another good example. So let me actually plug another good resource in case you guys aren't familiar with it. There is
Mm,
a resource called Help Hub that
mm,
uh, my colleagues, different Medicaid advocates created when the Affordable Care Act passed. Basically, it's like I'm on Help Hub. Like I have a little account. It's free. It's Illinois. There's like 4,000 helpers on it, and it's essentially if you work with people on Medicaid and you're like, I have this case, like you don't give specific, the identifying information, but you say like, I have this case, like I have this person who came to me and they were just released an ankle monitor. They're being told they can't have Medicaid right now because they're still a part of the system. Is that true? There are
mm,
experts that will answer that question and help. If it's like, oh no, that's not true, that person can get Medicaid, they will help you, the helper, figure out what the situation is and rectify it essentially. So I would say like, I don't help a ton of people on Medicaid in a year because that's not my day to day. But I'm on Help Hub because when I need to, I go on and somebody comes randomly to me, connects with me, and I'm like, I have no idea. I'll go on Help
mm,
Hub and ask the question, and I get help.
mm,
And so if I will afterwards, I'll share information about Help Hub, how you can create an account. That's another really good resource.
mhm,
It's again specifically for Medicaid and Affordable Care Act, so health insurance questions. But there are experts in Illinois who are answering these questions every day.
mhm,
And there's like a FAQ. So sometimes what I first do actually is I see if my question has already been asked and answered
mhm.
before I ask it again. But if I don't have time, I'll just ask it again.
Thank
Um,
you. So you said help, HELP, help,
Health
HB.
HUB, yep, Help
All right.
Hub. But I will share the link to it afterwards with Mark, and then Mark, if you wouldn't mind sharing it with the group. There'll be a blurb on what it's about and how you can anybody can create an account who's a helper in
Yeah, that
Illinois.
sounds good. Thank you so much.
Of course, of course. I know
Awesome.
we're coming at time. Yeah. So let me pause and see where you wanna yeah, how you wanna use these last few minutes together. Sorry.
I'm feeling like it's that an hour is such a short amount of time for introducing this huge topic. Nadine, I'm so deeply appreciative of you sharing what you know with us, and I'm hoping that you may be open to us inviting you to come back and in the coming months as there's more information about the plans in Illinois for implementation and what it can be helpful to folks and agencies to know and what they can do. Um, it's really helpful to get introduced to more of the information today. I just want to open it up. I'm curious, Joyce and Tracette from the Volunteers of America Work Incentive Planning and Assistance Program, if it's even come into view as a WIPA area of focus, the Medicaid work requirements, if you have any additional information from your perspectives. Maybe they had to step away for a second.
Hey, Mark. It's Tracette.
Hey, Tracy.
We don't have any concrete information about it. Um, when we do our BSNA reports, um, the language is pretty standard about how to maintain medical coverage when working. But most of the times, the our clients are exempt because they receive either SSI or SSDI. So we were waiting for that confirmation that they would exempt them because of that.
They are.
Is that is that a possibility that under the interim final rule that if people do have, if they are SSI and or SSDI beneficiaries, that they will be exempt?
They should, yeah, they would be
Yeah.
exempt, and not just under the interim final rule, in HR1. So that I'll find the language. So those folks, I'm trying to think if there's a scenario. They're not going to be an ACA adult. Again, remember, Medicaid work requirement only applies to ACA adults. So those folks would not be an ACA adult. So that's why they would not have to comply with
Got
it.
it. Right.
I'm
Right,
trying to
right.
think if there's a scenario where somebody could be an ACA adult and have. There should not be that scenario in Illinois, but I will double check. But
They wouldn't need the
Unfortunately,
ACA access if they were enrolled
exactly.
in SSI.
yeah, they do. Our clients somehow they tell us federally, like in training, like they're not supposed to be ACA, but for some reason Illinois does it. So we do have
Oh.
clients that have ACA, adult
Mhm.
Medicaid. I have no idea what button they pressed at the DHS, but
Enrollment.
they are.
Hmm.
But we did get information that they would be exempt because they receive SSI or SSDI. So that's what we were waiting on, Mark. We don't, because they have that exemption, we're just telling everybody you have that exemption because you receive that benefit.
And that's the end of it for those folks. They don't have to deal with it. That we want to, our goal really, in terms of like at least my party, my goal first is to make sure that folks who do not have to comply with the Medicaid work requirement don't, and that they know that they do or do not. Because that helps us narrow down, again, our pool a lot. And then once we figure out, okay, this person does, for sure, then helping them, then seeing if they can be exempt or excluded. So Teresa just gave an example. Their folks, because they have SSI and SSDI, or they're exempt, even though they're an ACA adult. There are other groups like that, right? And then if we figure all that out and this person still has to comply, okay, then how do we make sure that they are meeting the work requirements so they don't lose their Medicaid? And I'll stop there. Go ahead, Mike.
And I'm just aware that we're in the last couple of minutes, but I have understood that in the first year of implementation during 2027, there's a one-time opportunity for individuals to self-attest that they are a person who is unable to work due to a severe and complex medical condition, that it's only good for that one time, and maybe it's only good during 2027, but that it's potentially an opportunity during the chaotic first year of implementation for a significant number of people to be exempted, at least during that 1 year period. Is that correct, as you understand it?
So it's up to the state to decide how to do this and how to implement it. But the IFR says that in 2027, yes, a person can self-attest that they are exempt from the Medicaid work requirement, even though it applies to them. However, in 2028 and beyond, remember that they have to do this twice a year, not just once a year, the showing that they're meeting the work requirement. So in 2028 and beyond, what IFR says is a person can self-attest once, but not twice, not the second time in the year. So it makes it more complicated. So the state has a choice of how to implement this part, and we don't know what they're gonna do yet. So to be determined, but I think to your larger point, there is a self-attestation piece, which is happening with SNAP right now, with the SNAP Medicaid, with the SNAP work requirement. People can self-attest. And actually, that would be my message for SNAP right now, this year. People can self-attest. There's a self-attestation form for themselves. They don't need a provider. They don't need anybody else to fill it out for them. And that is enough to give into DHS this year and be exempt from unless there's like, DHS looks at it and is like, I want more information about this, then they can ask that question. But there is a self-attestation form for SNAP right now that people can use. So I'll include that as well, because I know a lot of folks have
Awesome.
gone to providers to try to get exempt, and they can, but they don't need to. There's a form for themselves to just self-attest for SNAP. And there will be the opportunity for Medicaid. We don't know exactly what it's going to look like just yet. The state has to make some decisions.
Nadine, I'm so deeply grateful to you for sharing this information, and I'm really greatly appreciative of each person in the meeting who chose to better inform themselves and learn more and help our communities to be prepared for managing this policy development that is of such concern. I hope that we can continue this discussion and conversation and information sharing to help better prepare our communities who I feel have had far too limited an opportunity to be informed to take care of themselves. So I'm appreciating the opportunity for this venue to be part of that process in the community, and welcome all information sharing from everyone. And Nadine, what you send, I will share to the listserv. Thanks so much, everybody.
Bye, everybody.
Thank you.
Bye. Thank you so much.
Have a good day.
Bye-bye.
Bye. Have a good one.
You too.